what practical advice do you have for other mental health leaders or social entrepreneurs about building an authentic, mission-aligned online presence?
There's got to be a deep caring of the cultural context. It's got to be a bottom-up approach. It's understanding your working class, working classes, right? It's understanding the regional and provincial cultures. On top of that, Filipinos don't have a singular culture.
Right.
People from Metro Manila are different to people from the Visayas, to the people from Mindanao. I'm from Mindanao. All my family's from Mindanao.
Really?
And so
We're from.
that's
may I
right.
ask?
Right there, the little city
okay.
called Dapitan.
Oh, okay. I'm from Zamboanga del Sur in Zamboanga City. So
Wow.
we're fellow Zamboangueños.
There you go.
But the culture in Del Norte is different from Del Sur, even.
Hey everyone, welcome to another episode of Presence Matters, the podcast where we explore the stories and strategies of leaders who are shaping the future of health and wellness in the Philippines. Today's episode is especially meaningful because we are in the month of September, recognized worldwide as Suicide Prevention Month. It's a time to raise awareness, break the silence, and remind each other that every life matters. Our guest for this episode is someone whose personal journey embodies both the pain of lived experience and the hope of turning that experience into purpose. Yuri Marshall is a suicide survivor who went on to found Mind You Mental Health Systems, a pioneering platform making mental health care measurable, accessible, and culturally relevant for Filipinos. As CEO, Yuri has led Mind You to partner with organizations across industries, serving employees from small businesses to the country's largest enterprises. His mission is clear: to reduce the cost of mental health support, destigmatize the conversation, and to build technology that ensures care is private, continuous, and effective. In this conversation, we talk about his turning point from personal crisis to corporate advocacy, the gaps in mental health support in Philippine workplaces, and how leaders, policymakers, and communities can work together to expand access to care. So, in light of Suicide Prevention Month, this episode is both a reminder and an invitation. Mental health is not just a side issue, it's central to how we live, work, and thrive. So stay with us. This is an episode about hope, resilience, and why presence truly matters.
Okay, so welcome to Presence Matters interview with Yuri Marshall. Our theme is about building measurable, accessible mental health care in the workplace and beyond. Yuri, welcome. Thank you very much for indulging us and joining us in this session. You're a suicide survivor who turned lived experience into founding Mind You. Can you share the turning point that led you from personal challenge to corporate mental health advocacy?
Thanks, Joseph. Good morning. It's great to be in the conversation with you. I think the turning point for me really was, coming out of my own battle with mental health. Previously, I was in the legal industry. So there was an opportunity here in the Philippines because of the new Mental Health Act. And because I had just survived, my own experience, it was just an opportunity for me to really ask myself the question, do I want to continue in a career that's just paying the bills, or do I want to do something that's going to now matter? And for me, mental health was the most critical topic at that juncture of my life. And I've now dedicated half a decade towards it ever since starting, mind you.
Awesome. So what was the founding mission of Mind You, and how has that vision evolved since 2020?
That's correct. The mission originally was to tackle three major areas. So, which was number one, to reduce the cost of mental health support services, because in the Philippines, we recognize that's one of the major barriers. The second is to destigmatize and normalize the conversations. The state of education about mental health in the Philippines is so far behind that people think that culturally, You have to be crazy, to see a mental health professional. But they see a doctor when they break their arm. And here we are, people, losing their lives every year in the Philippines at staggering rates. It's an ignored area of health. So that's the other thing, right? So just destigmatizing the topic. And the third is creating technologies to make it accessible so that you don't have to go to a clinic. You can do it in the privacy of your own home, do it in your own time,
Awesome.
on demand.
Depression isn't really something that people should ignore. So your mission really is something that can help make the stigma of mental illness in any form to be recognized. So thank you for that. Mind You has pioneered culture sensitive data driven EAP solutions. What gaps in the Philippine workplace landscape were you aiming to fill?
The major gap is the lack of psychological safety. Typically, you'll have staff working in a company, and if there's something wrong with their health, they go to HR. They use their EAP. The problem with that and mental health is that people are afraid to access that support and tell their employer that I'm suffering from depression, anxiety, stress. I can't show up to work. There's a fear of being judged. There's a fear of losing their job. So, that's the major gap there, is the lack of understanding that there needs to be data privacy. So we've been able to fill that gap. And if you look at the insurance landscape in the Philippines, it's reactive care. They
Mm-hmm.
don't cover preventative care. So what the insurance companies and
interesting.
EAPs and HMOs don't cover, that's where Mind You comes in. We fill that gap that the insurance companies don't currently cover for employee benefits.
So is that made available for blue collar, white collar?
Yes. Over the last 5 years, we're now serving companies across 40 different industries. So that does
I see.
include white collar and blue collar.
Okay. And you recently introduced a 24/7 triage helpline and integrated ICF trained coaching. What's ICF coaching?
That's the International Coaching Federation. So it's a minimum level of qualification for coaching. And mind you, quality care is paramount because we consider ourselves a premium service. Everyone's licensed. The difference between ICF coaching and non accredited coaching is that ICF coaching is a competency based methodology of coaching. There's a standardized minimum level of quality that you can expect from the experience, and it really is designed to allow you to thrive in whatever area of your life that you're seeking coaching for.
Have you seen any improved mental health outcomes from employees?
Across our practitioner landscape, this is psychologists, psychiatrists, and coaching. Yeah, we've seen, it depends on industries, but I think if you amalgamate it all, it's close to 13% drop in depression rates, a 10% drop in stress rates or workplace environment that contributes to stress. But every company that we serve, they have their own psychometric data. So that's the other thing that Mind You excels in the country is we provide data analytics to the companies so that they can make decisions for their business based on data rather than hearsay.
Makes sense.
It's tough when staff are taking leaves or calling in sick and they're not telling the business the real reason why, especially if it's mental health related. It's a source of truth, right? It's a different source of data truth that the business now has access to.
Right. So I'm guessing you're working with the HR department on this to get the data and provide with a better look at the mental health of the employment pool.
Yeah, we don't share personalized data with
Right.
company HRs. Yeah, the Mind You platform just provides the mental health support services to staff. And then there are data collection points within the platform that are all anonymized because we're only interested in understanding what's causing people's mental health challenges and then reporting that in an anonymized way back to the organization so they can make better management decisions. Ultimately, it comes down to psychological safety, and employers need to understand that the people that are driving their business is their staff.
Right.
If you don't take care of your staff's different areas of health, they're not going to perform. It's simple as that.
And the attrition rate would be something to be worried of.
Attrition, yeah. There's a new term called presenteeism, which is staff that are present at work, but mentally absent. They're not actually
Uh-huh.
working,
Interesting.
and so that could be caused because of family problems, fighting in the workplace, any number of mental health contributing factors. And
Right.
so that's an area of loss of productivity. A
Right.
lot of organizations either ignore that or they've just been unaware of that.
Now, as a culture savvy mental health provider, how does MindU navigate cultural stigma around therapy and mental health?
The methodology we use is based upon the research from the chairperson of Harvard's Global Research for Mental Health, Dr. Vikram. And so it's a decolonized form of mental health. So in terms of cultural sensitivity, we have a health department that has multilingual capabilities, multi-religious capabilities. We can conduct one-on-one talk therapy sessions or group sessions. It's really taking into account the local culture when you're providing, the talk therapy, because you can't ignore those local cultures. The education system trains psychologists with a Western colonized frame of mind, frame of clinical therapy. But it's different in the local context. We care about family values, social structures, relationships. These all play a part in the best way to approach the health of your mind.
It's interesting. We've also other nationalists that work in our current pool. How do you handle those?
For people that are already part of the Western cultures, your typical clinical therapy is already effective. DBT, CBT, whatnot. So yeah, the licensed psychologists we have are already very well versed and trained for your other nationals that are in country.
Okay, that's good. You partnered with Health Now, which helps with expanding access. What's your longer term vision for scaling Mind You beyond corporate clients to reach individuals nationwide?
Yeah, the old partnership with Health Now is no longer there because Health Now has been amalgamated and merged into Ayala's super app, which is the Consulta MD. So, for Mind You, our goals are very different to your commercial medical platforms. We've got very different values. We've got continuity of care, data privacy and protection. We don't want to commercialize the data.
That's very important. Yeah.
It's not only important, it's necessary. There's talk of universal healthcare in the Philippines. The bill has been debated, and it is going to be coming in. The thing is, if you want to bring in a universal healthcare system, the actors that are playing on that stage, they need to act like responsible healthcare providers. And so you have to protect patient data. You have
Right.
to give patients continuity of care, which means don't just sell them a drug right away. You have to find the root cause of the disease and see whether there are non-pharmacological interventions. Can you eat better? Can you move your body? Can you develop better relationships with the people around you, even a relationship with your own mind?
Right.
These are all super important areas. People get sick just by being stressed. Think about that. You can get sick just from being mentally, incoherent, just completely stressed. And people go to the doctor and they just give them a pill. But the root cause is psychological in a lot of instances. Follow the data in the Philippines is like 15.4 million up to 17 million people suffering from mental health conditions. And
Where did
so
you
there,
get
there
that
needs
number?
to be, that's a combination of either DOH and WHO. They both have
Okay.
slightly different statistics. But there's a lot of work to be done, honestly. For us, we're avoiding those e-com platforms turned medical platforms and really want to
Gotcha.
just focus on being a universal healthcare player in the Philippines.
That's good. Now, from a lived experience leader's perspective, what role does public disclosure and visibility play in the stigmatizing mental health conversation?
Well, what do you mean by public disclosure, Joseph, in terms of
Meaning the number of people that are suffering from mental health issues, that these are symptoms that needs to be treated. But there's a public disclosure that these are also required to be taken care of rather than just making it into a statistic. Does that make sense?
it does make sense, yeah. Because of the Mental Health Act, there is now at least a legislative arena in which the government can spend towards that health sector. Public spending and activities, I see it. It's happening. There is a wave of mental health awareness and education that the government is engaged in, and the private sector is catching up too. In fact, the private sector is leading the way with technological solutions and adopting them. I think that's where the marriage needs to happen. There's a lot of public education, but I think that the government needs to invest in technological access to people because that's where the private sector's that's what they're doing. We're
Mm,
covering companies across 40 different industries. It'd be nice to see LGUs and national government level agencies also utilize modern technologies.
correct. I agree with you on that. Now, you've leveraged lived experience, corporate innovation, and public speaking to make significant impact. Here at Tatakmo, we help leaders like you amplify your digital presence so your credibility and mission reach far beyond our immediate circles. Now, what platforms or formats other than LinkedIn where we got in touch with? Speaking events, content have been most valuable in shaping public trust and awareness around Mind You. What processes have you set up in place?
I'll be honest with you, Joseph. I've never been a fan of selling or marketing before we have properly engineered and built a system, a
Mm-hmm.
health system. So the only things we've done publicly really is we participated at the Global Startup Awards where we won the best health tech in ASEAN.
Congrats.
We were the only representative from the Philippines actually on the global stage. We are very proud of that. Other than that, there's just LinkedIn, and really it's a bottom up approach. Our
Uh-huh.
raving fans, our clients, we've got clients from day one that are still with us today. And we just allow that
Nice.
to rise our reputation or to lift
Uh-huh.
our reputation.
Uh-huh.
And then we get referrals from just from doing good work because we are foundation building. We didn't hit the marketing first and trying to sell first and looking pretty. We wanted to really focus on patient care and data management, data analytics. That's super important because that's not even present
Mm.
from a reliable data analytics standpoint in the Philippines. It's very new. And I'm super proud that we're servicing some of the national brands, like homegrown brands,
Uh-huh.
Philippine Airlines, SM, Grab, Gcash, BPI, all of the companies that really take care of their staff. Concentrix is another one, the largest
Uh-huh.
employer in the Philippines.
Um,
We're
I
we're
would
obsessed
guess
with taking care of people.
that's awesome. I would guess your niche would be a company with 1 million employee.
We have three different segments. We do service small business, medium
That's
business, and large enterprise. We actually have a new product just designed for the small businesses. It gives them
uh,
access to the hotline. So I think one thing to also, just maybe point out is that MindU's technology systems have been developed in partnership with the Australian government through the Australian
mm,
Embassy.
mm-hmm.
So even the hotline itself was done through an AusAid partnership. So the
I
way that
see.
a hotline operates is how it would operate if you were living in a country with a universal healthcare system.
Yeah. Now, how do you balance transparency about your own journey with professional messaging as a CEO and advocate?
It's just about being honest. It's just about being transparent. My lived experience is just one big, massive message that, you have to take care of your mental health because it can lead to an extreme event. And the data for loss of life in the Philippines, annual recurring loss of life due to suicide is close to 800,000 per year. What's being done about that?
So, what practical advice do you have for other mental health leaders or social entrepreneurs about building an authentic, mission aligned online presence?
There's got to be a deep caring of the cultural context. It's got to be a bottom-up approach.
Mm,
It's understanding your working
right.
classes, right? It's
Awesome.
understanding the regional and provincial cultures. On top of that, Filipinos don't have a singular culture.
Right.
People from Metro Manila are different to people from the Visayas, to
Yes.
the people from Mindanao. I'm from
You know.
Mindanao. All my family's from Mindanao,
Really?
and so
Where from, may
that's
I
right.
ask?
Parte, the little
Oh,
city called
okay.
Dapitan.
Oh, okay. I'm from Zamboanga del Sur in Zamboanga City. So we're
Wow,
fellow Zamboangueños.
there you go.
But the culture in Del Norte is different from Del Sur, even.
Even so, it was a challenge in the initial years for us to hire psychologists from even the Visayan areas.
Mm-hmm.
But now that we've got that in place, it's great. We're able to service Filipinos across the country.
That's awesome. That's good. So you get to use the local pool, the talent pool, to be able to service people from different parts of the country. That's great. What emerging trends in workplace mental health, from technology to policy, are you most excited about?
I think what's most exciting and scary at the same time is the emergence of AI. It's
Mm,
exciting because there's so much that can be developed there, and scary also because we're living through the transition. So we're still determining how do we weed out all of the non-factual things that are in the open source environment. Where is the truth? Where's the truth and the source of facts going to come from? And I think for us, we're looking at maybe developing some small language models where we input local data, local information, local analytics that pertain to our local culture, so that when people look up mental health solutions for Filipinos, it's going to be solutions that pertain to us, because we're not Americans. We're not, Chinese, or even myself being Australian Filipino. I would say that we're not even close to our neighbors' cultures. So super important to figure that out from an AI technology perspective. But we're doing it. We're investing in it. We've got a lot of news coming out in the next year or so. It's going to be quite exciting.
How can Philippine businesses, health systems, or policymakers work together to expand mental health access nationwide?
I think there needs to be a combination of, you know, economic unity across the industry, the health industry. It's very fragmented. Information systems, data sharing protocols. There needs to be government investment in these areas. There's no unified patient records management system. That's not an area that we're looking to tackle at this point in time, but we are building an ecosystem of partners, because we have partnered with, a medical hospital group, and we're looking to expand that. But essentially, it needs to be a bottom down, bottom up approach, where they need to really need to study what's happening on the ground
Mm,
to develop solutions that are stepping up from where they are. So an example is, if you're using a legacy computer system, MS-DOS,
mm,
and there's a lot of
yeah,
legacy systems like that across the country. What's the next step up from that? Right. And so it's really the bottom up approach. How do you create development and progression to meet people and systems at where they are right now? That's the key to progression, at least from a local perspective. So yeah, there's that. And then just a very deep caring of the actual human experience, the patients, the
patience,
users.
right?
It's super important. Sometimes I see a lot of, founders, entrepreneurs, and they see people as numbers.
Correct.
And I think that's all in good, and it is important to measure your economics, but you have to start with the human experience first.
So true. Thank you so much for time again, Yuri. And just for reference, where else can viewers connect with you or explore Mind You's latest development?
Visit the website, which is mindyou.com.ph. So on social media platform, our handle is at MindYouMHS, which means mental health systems. We're just dedicated to education and awareness. And if people are looking for a reliable, quality mental health resource and service, you is going to be the right partner for you, because we do truly care.
Thank you so much, Yuri. And I appreciate what you and Mind You are doing to improve the Filipino healthcare, the status of the mental health of the country. So thank you so much, and more power to Mind You. And I look forward to speaking with you again soon for your latest developments.
Thanks, Joseph.
Thanks, Yuri. You have a good day and a good rest of the week.
Fantastic. Thank you for the invitation.
Bye.
Connect with Tatakmo and explore more stories of healthcare and wellness success online, because presence matters.